So today I'm going to be talking to you about pediatric imaging. First of all, there are two types of radiation, ionizing and non-ionizing radiation, which procedures are broken down into. X-ray, CT, and nuclear medicine are all forms of ionizing radiation, and MRI and ultrasound are forms of non-ionizing radiation, which is much safer for children. So X-ray is the oldest and most common type of diagnostic imaging. It is a picture taken of the inside of the body using ionizing radiation, which can pass through thick tissues of the body. It can be used to diagnose pain, injuries, and locate foreign bodies. CT combines a series of X-rays into cross-sectional images, which are taken from different angles. It can also be used to diagnose pain, cancers, and inflammatory disorders. And the last form is nuclear medicine, which uses very small amounts of radioactive materials to examine organ function and structure. The radioactive material will accumulate in tumors and is either injected, swallowed, or inhaled by the patient. So now on to non-ionizing radiation. MRI uses a large magnet and radio waves to create cross-sectional images just like CT. It can diagnose conditions due to injury, illness, or congenital abnormalities. And lastly, ultrasound uses high-frequency sound waves to produce images of the body. It can be used to diagnose pain, swelling, and infection. It can be used on pregnant women. And doctors can examine developing babies to check their brain and their hips and make sure they're developing correctly. So the biggest difference between child and adult is their size. The smaller a child is, the less radiation they need. If a child is exposed to too much radiation in their life, they will be at a higher risk of developing cancers later on the road. So how do we reduce radiation? We can reduce radiation by setting manual techniques, by practicing ALARA, which stands for as low as reasonably achievable, the use of lead shields, and setting low exposure times. So if you don't set a low exposure time, there's more likelihood of the child moving. If a child moves during exposure, they need a repeat. And repeats will just cause more radiation to the child, which we do not need. So lastly, the benefits definitely outweigh the risks. The benefits of using diagnostic imaging include the diagnosis of illnesses, being able to monitor the disease and the treatment, and locating foreign objects.